Welcome to True Wellness with Dr. D, the podcast where we explore what it takes to live with vitality, balance, and purpose. I am Dr. D, and each week I'll bring you powerful tools, inspiring stories, and expert insights to help you thrive in every area of your life. From health and wellness to mindset and navigating life's challenges, this podcast is your guide to creating a life of true well-being. Be sure to check the show notes and grab your free copy of the True Wellness Checklist so you can get started on your journey to true wellness right away. Now, let's get started. Welcome, everyone, to another episode of True Wellness with Dr. D. I'm excited to have you all here today and our very special guest, Alex Lubarsky. I want you to imagine if we had the option to be able to change and transform our health, and we knew that we had that power within, would we be giving it away all the time? And that is something that Alex and I are going to talk about today, because we live in a world, in a society where we have given away our power when it comes to our health. Now, Alex, he is the founder of the Science of Human Optimization. He is the author of several books, The Art of Selling, The Art of Healing, and how rebels of today are creating the healthcare of tomorrow and why your life depends on it. And his latest book, Youthful Longevity, Why Living Till 100, Vibrant, Productive, and Fulfilling Years is Your Birth Date and Your Mandate. And you guys, this is pretty important. You've heard me say time and time again, your health is your power, is your birthright. And that is exactly what Alex stands for. I mean, the last 25 years, over 25 years, he has been a passionate advocate and promoter of some of the most innovative physicians, specializing in ageless beauty, peak performance function, youthful longevity. I know I've had the honor to be on Alex's stage before. And I remember, of course, Alex, I'm going to share the first time I ever met you and saw you. We were parading around Long Island. I forget what town we were in. Was it Huntington? I don't remember where we were. It was?
Huntington, yeah.
Yeah, we were in Huntington promoting the expo for human optimization, right? And you were wearing the Uncle Sam outfit.
Yes, I was.
And how could anyone miss that?
And it wasn't a cheap outfit. I wore like a high quality outfit with a hat, and I had a cool buckle and the bow tie and everything. It was a very, very, you could wear that to like a Broadway show. You could really, it was a good quality outfit.
It was a really good quality outfit, and you played that part. But here's my question for you. Why were you wearing the Uncle Sam outfit? What is the message that you wanted to convey to people?
Well, when we first started doing this, my thought was like the greatest country in the world, which I truly believe that we live in.
We do.
And it's such a remarkable place. But even 25 years ago, I was seeing how people around me were becoming sicker and more obese and developing all kinds of chronic conditions. Yes. And they were more dependent on pharmaceuticals. Yes. And they were consuming a tremendous amount of processed food and didn't give it any thought. In fact, if I would bring up something as simple as you should eat organic, the amount of resistance I received then was just unbelievable, really.
Yes.
So I thought to myself, America should be the healthiest, most fit, and longest lived people on the planet. That's what I was saying 25 years ago.
Yes.
And now, I think my message caught up to the winds that are actually creating Make America Healthy Again. So that was the thought, that I am the representative of the American people, and that we are marching for our neighbors, our friends, our family, so that they can be healthy, well, and live a long, fabulous life.
Yeah, I love that, because it does feel like, so number one, I'm right there with you. People are like, eat organic? Oh my gosh, right? I mean, it has certainly changed over the last 25 years. We're seeing a shift, which is magical. But yeah, here we are living in one of the greatest countries on the planet, and yet we've got some of the worst health statistics that exist. And it makes you kind of scratch your head, and you're saying, like, what the heck is going on here? How did it get to be this way? And I know you've been a pioneer for the Long Island community in bringing that whole other, that whole paradigm shift in, hey, there's another way. We've just got to step into the driver's seat and start to look at and do things differently. And, thank you for the profound work that you have done within the Long Island community, bringing all of that to the light.
Well, thank you, Dr. D. It's been a labor of love. And I met some really remarkable people whose lives were transformed because they met iconoclasts in the health community that were brave enough back then to speak about things that nobody else spoke about. And so it's very difficult to find the answers to a complicated problem in a system that doesn't want those answers to be revealed. On the other hand, if you follow people that are looking for simple solutions to complicated problems, then all of a sudden you discover things that seem miraculous.
Right.
But it's science, and it could seem miraculous, but it's simple when you know the combination.
Yes. I think so. Let's touch on that. I'd like to dive in there a little bit. You said that we're in a place or a system where we're not being shown or revealed sort of what the possible answers or solutions are. Tell me a little bit more about what you mean by that.
Well, at some point, the system discovered that our sickness and disease is much more profitable than our health and well-being. And the American healthcare system was basically non-existent in 1965. It was about $27 billion per year. But then when the government got involved in healthcare through Medicaid and Medicare, it started growing exponentially. And by 1995, it hit $1 trillion for the first time. So the question is, what came first, the chicken or the egg?
Right.
Did we need $1 trillion worth of medical intervention to manage all of these chronic conditions that we all of a sudden developed?
Yes.
Or do we develop all of these chronic conditions because they became very profitable? And so the context that we're operating in kind of facilitates all of these conditions in us. Is it by accident? Is it on purpose? I don't really know, and I don't care. I just want it resolved.
Yeah, let's change it. It's funny because I think as a society, right, we've normalized, or things have been normalized for us. I often use the analogy, Alex, of fleas in a jar. So if you put a bunch of fleas in a jar and you put a cover on that jar, now those fleas, they can jump 6 feet high, but they'll hit their little flea heads on the top of the jar a few times, and then they'll stop jumping. And then if you actually take the lid off the jar, they'll stay in that jar, even though they can get out very easily. And it's almost like that's the way that we have been trapped in the healthcare system. It's like we've been trained to go to the doctor, get our prescription, and that's it. We're done. We've been trained that as we get older, we should feel worse. We should put on weight. We shouldn't have, the energy levels that we used to. We shouldn't sleep through the night. We should suffer from anxiety and depression. And these things have become like normal, and so the cycle goes, it's a pretty nasty cycle that just keeps going around and around until someone says, hey, wait a second. Something's wrong here. It doesn't make sense.
Yeah. And those people are rebels like you and a few other people I know who kind of enlighten me on what the possibilities are. Mm-hmm. And I just was trying to share that message with people who were interested in hearing it.
Right.
So I had people come up to me, still people reach out and tell me, Alex, your events transformed my life. Well, it wasn't the events. It was the people who were speaking in the events.
Right.
And so, yeah, I still get messages for when you're doing the next to transform my life. Okay, I'm turning the chapter on that. I'm doing something different.
Yeah. Well, I mean, Alex, what's your story? Right? What brought you to this place? Because I don't think any of us really started here. I think there's something to us that happened in our lives that made us be like, oh my gosh, there's something wrong. Like, for me, when I was little, I grew up essentially in the doctor's office. I was there all the time. And it was, the same thing every time. I'd get the nebulizer treatment for my asthma, I'd get the, steroid injection for my rear end. And everybody just thought that was normal. Like, oh, Danielle had asthma. She got a lot of, sinus and infections and allergies and
Yeah.
ear infections. And that was just kind of par for the course, but we didn't know any different, right? Like my family never knew any different. It wasn't until personally for me that I got to college and then the, freshman year of Columbia, all the digestive issues started. And I went to the doctor and he wrote me a prescription. And I'm like, well, how long do I take this for? Because, at least when I went to Dr. Platnick, it was like you take it for 10 days and it's over. And he's like, oh, no, you're just going to take this. And I was like, I'm like 17, dude. This doesn't make sense. What are you talking about?
It doesn't make logical sense, but it makes financial sense.
Yeah, exactly. Exactly. So, I mean, I think we all have to have that sort of wake up to be like, oh my gosh, something isn't working and something doesn't make sense. What was yours?
Well, my father wanted me to be a doctor when I was 10.
10, huh?
Yeah, so he would introduce me to people. He said, this is my son, Alex. He's going to be a doctor. But, life has a funny way of turning you in different directions. So I didn't actually become a doctor. I got involved in business. I was in transportation. I was in jewelry business. I was in marketing business. I was doing business. I like business. I like people.
Yeah.
I like thinking of creative ideas and try to sell them to the market. So I like that. And then in my early 30s, I started developing bumpy fingernails.
Mm-hmm.
And so I didn't think much of it. I haven't been to the doctor since the day I was born. But then eventually I started developing a rash right around above my right ear, and then it wouldn't go away.
Yeah.
So I put butter on it. I put everything in my wife's vanity cabinet. I put on there, but it would just get worse from one week to the next. So eventually I said, you know what, where's our health insurance card? So we dug it up, found it someplace, and I booked an appointment with a dermatologist.
Right.
And the dermatologist, his earliest appointment was in a month, which I right away thought, that's a little weird because I thought we have the best healthcare in the world. And that would probably mean you go see a doctor immediately. That would be my interpretation of the greatest system in the world.
Right.
So fine, whatever. I wasn't in a hurry, but I went to see this doctor. He came into the room and he said, what's the problem? I said, this is the problem. He said, oh, you have psoriasis. Here's a sample steroid cream. If you need more, give me a call. Have a nice day. That was the end of our meeting. So I put the cream on, and on the way home in the car, I opened the thing, put the cream on, and like a couple of days later, it went away. I was like, okay, get back to business. Forget, the problem is solved.
Yes.
But then a few days later, it came back worse. So I put more cream. It went away. A few days later, it came back worse. And I had like both sides of my head all red, and my, then eventually went to a lot of parts of my body.
Uh-huh.
And then worse than that, I started developing arthritis where I could barely walk. My hips hurt so bad.
Yes.
I couldn't pick up a cup because my fingers and wrists were so inflamed. And this is early 30s. So I was really headed for disability. And actually, I'll tell you. So, but then about a year before this happened, I created a radio program. I bought some time on a local radio station. And I was interviewing a lot of the doctors that I met in my new business. We were marketing doctors into centers around New York.
Yes.
And as I was going to these centers, I met some doctors that were weird. They were strange. They were weird, strange, in that they were fit, they looked thin and beautiful, vivacious.
Yes.
And they didn't really care about business or marketing or any of that. They were interested in helping people get well.
Right.
And they would manipulate the health insurance model in whatever way they could do so that they can do their, witchcraft, the good kind. And so I just found their approach very interesting. I like these people. They were very likable also, like authentically likable.
Yes.
So I thought to myself, I want to share their message with people and maybe, develop some goodwill. So I started doing this radio show. I was interviewing a lot of these doctors. And so over about a period of a year, this philosophy unveiled itself, the power that makes the body, heals the body.
Yeah.
Health comes from the inside out, not outside in.
Exactly.
You cannot solve your health problem because you have aspirin deficiency, stuff like that. So then when I was in this dermatologist's office, these two worlds came together. My understanding that this 2-minute meeting and the medication isn't going to solve the underlying problem, whatever it is.
Right.
And so that kind of propelled me in the direction of wanting to figure out the answer because I wasn't finding them. So I went, but before that, I went to other doctors with my insurance card, and it was relatively the same answer. Methotrexate, which is like a chemo-like drug. So anyway, I found this. This Dr. Richard Lynch's. So you remember, I'm sure, Dr. Rick Lynch's. So Dr. Rick Lynch's reached out to me because at that time I was already organizing little conferences.
Right.
And he was diagnosed with terminal lung cancer in his early 50s. Mm-hmm. So he retired from his very, very large and busy pain management clinic. And he was kind of searching for answers to his terminal diagnosis.
Sure.
And so about 2 years into that, he reached out to me. He was in this little tiny office where he was just helping his friends and family trying to resolve their issues. And so he said, I want to market this new model. We didn't call it functional medicine then, but
right.
This model of holistic care. I said, well, great. I'll be happy to help you market it. And by the way, I have this problem. Maybe you can help me solve it. And this way I can be, firsthand experience of what exactly did you do exactly.
Yes.
So long story short, within 90 days, he helped me resolve the arthritis part of my diagnosis.
Wow.
And it was really like a miracle because for 90 days, everything he did, and he did a lot of stuff. Nothing happened. 90 days, nothing happened. Day 91, it disappeared like I never had it. And I was doubting, and I was like, holistic, what is this? It costed me thousands and thousands of dollars for supplements and testing that insurance wouldn't cover. And I was like, this is ridiculous. Everybody's telling me it's ridiculous. But somehow it felt right.
Yeah.
So that's where kind of my journey began, because I was a believer that the body has incredible potential to heal if you provide it with the necessary environment to do it.
Yes.
And so the proper context for healing has to be created. We are not responsible for, miracles.
Right.
Our job is to create the environment for miracles to happen.
Exactly.
So that's what he did. He created the environment for a miracle to occur, and occur it did. So.
Yeah, our bodies are just so incredibly designed. Even in our agreements when we start with new clients, it's like, hey, I'm not here to fix you. It is the job of your body's own natural intelligence. All we're doing is getting things balanced so that your body can do what it was designed to do.
Yeah,
and that's all it wants to do.
It really wants to do that, yes.
Yeah, we're not here to fight our bodies. Our bodies are on our side.
Yeah. So that's what it is. The system has been created to profit from our chronic disease. It would have been much more profitable if I had my arthritis and psoriasis for the rest of my life, because right around that time when my arthritis was healed. I mean, it's been 25 years, so I guess I can say healed. A friend of mine reached out. She had rheumatoid arthritis diagnosis, also a little maybe younger than I was at the time.
Sure.
And I said, look, I had this miracle happen. Go see my friend, Dr. Rick Lynchett. He'll give you a discount. Mention my name.
Yes.
So she did. She went, and she came back. She goes, it's $500 with the initial consultation. $500.
Right.
I have access to the best doctors in the world through my health insurance.
For my $20 copay.
I was like, at that time, I was like, okay. I mean, yeah, $500 is a lot. Wait till you start buying supplements. The bill grows bigger quickly.
Sure.
But she said no. And I wasn't smart enough at the time to convince her otherwise. But so she went the other way. And long story short, in 10 years, she became basically disabled.
Yeah.
And she was a powerhouse executive lady making $250,000 a year.
Right.
The mindset, it just blows me away.
Yes.
She would have no problem buying $5,000 purse. No, not even think about it twice.
Yeah.
But something like this, I don't get it.
Yeah, it is truly extraordinary, because it's almost like we have been conditioned to think that a $15 copay or a $20 copay or 25, wherever they are now, like that is the norm, and that's what should be expected. But it's happening in a system that doesn't work, that's not actually resolving our issues. Because, and I really do believe that a lot of our healthcare workers, even in the conventional model, their heart's in the right place. They want to do the right thing. And they are also, they're trapped in this system where, the insurance companies dictate, hey, the average American gets 7 minutes in the doctor's office. So we've got 7 minutes. And in that 7 minutes, they don't have time, Alex, to get to that underlying root cause of what's happening for you, that you're having the psoriasis. They got enough time to say, oh, that's psoriasis. Here's your script. I'll see you later. Come back if you need more, just like what happened to you. And so it's like, it's a trap, right? It has unfortunately become a trap. I have a friend I was talking to this morning, and she said, it's almost like, good healthcare. You've got to be in this whole other echelon to take care of yourself, because that's the model that we've been stuck in,
Yep.
So what had you personally take that chance? What was sort of the internal dialogue or conversation that?
It was no conversation. I got mad. I got pissed. I was really mad. I was like, I can't believe it. What a sham. Here we are paying all this ridiculous amounts of money into a health insurance.
Yes.
And you don't give it a lot of thought. You're paying it for decades.
And you don't see it. It comes out of your check usually, right? You don't even see it.
Yeah. So, and then when you actually enter the system, you find out that you're in the twilight zone. It's totally not what you expected, not what you imagined, not what you were promised.
Yes.
They just try to Band-Aid you and aspirin you until you pass on to that glorious other place,
Right.
And stop bothering them.
Yeah. Yeah.
So I got really mad, and I've always, like, when I see something not working or something out of place or something not organized, I don't like it. It makes me, like, even my wife and I, she doesn't so much care about organization, so I'll rearrange her kitchen cabinet sometimes.
Unless she can't find it.
Not conducive for a wonderful relationship, but I don't care. I need the lids from the plastic containers and everything else, to be in the right place so you can find them and don't have to search to open up a cabinet. Everything like falls out. I hate that. So I need organization, and the healthcare system seemed like it needs organization. I was just the wrong guy for the job. I had no interest in healthcare. I had no education in healthcare. I was not nice like a lot of the doctors that I've met who are lovely and gentle and well spoken. I wasn't any of those things. So, but it seemed like a challenge worthy of the effort. So here I am.
Standing up for looking at things differently, standing
Fighting for the
up.
people, fighting for the people,
Yeah.
Dr. D. And I think it's a worthy fight. And now, after 25 years, I've gotten the education of my life. I've met people who are absolutely remarkable. And now the winds are blowing in the direction that I've been like praying for all these years and imagining and envisioning. But I think finally, I think the last 4 years woke people up like nothing else.
Sure. Yeah.
We got to see a little bit behind the curtain.
Yeah.
Of what awaits them and the tyranny of our current model of healthcare.
Yeah.
When it's unleashed. And now you're seeing all the bureaucracy and all the theft and all the misuse of our money.
Yes.
Wait till they dig into Social Security and Medicare and Medicaid. It's going to blow your mind.
Yeah.
The kind of stuff they're going to unravel there. So this has been we've had a firm grip on an empty bag as regards our health.
A firm grip on an empty bag. I love that analogy. It really has been that. I mean, think about it. If you think about what you said before, like we're talking about organic food, and people are like, organic food, why would I do that? But if you go back in time, that's all there was organic food, right? So it is an empty bag.
Well, I remember telling somebody, you have to eat organic because they put a lot of pesticides on the apples and everything.
Right.
You know that organic grows in like poop? I was like, wow, organic grows in poop. It's like at the time I was also grew up in the same mentality, so I was thinking the same way. Yeah, this grows. I grew up in poop, but that's kind of the world we live in. We got to eat animals sometimes. We got to eat fruits that were grown in poop, and so they have all the nutrients that are necessary for a fruit to be of benefit.
Yes.
So it's a funny world. That's what it is.
I always say we've got to get back to number one, listening to our bodies, hearing what our bodies are saying, because our bodies are talking. When they're out of balance, they're kind of screaming. Sometimes they throw a pebble at us. Sometimes they throw a brick. Sometimes the whole mountain comes crushing down when we don't pay enough attention, And so, yeah, all of these little things, like, okay, that little bit of pesticide there, that little bit of this here, that little, like, it all begins to accumulate. And it becomes more and more for our body, which is brilliant, to have to sort through. And when we become burdened by that, that huge mess, it makes things a lot more difficult to bring into balance. But here we are, you're right. We're walking in a world where, you go to the grocery store and we think we're safe in the grocery store, right? We think that just because it's being sold, it's not necessarily poison. We should be able to eat it, And half of what's in the grocery store, probably more than half of what's in the grocery store, literally is poison.
It's worse than that. Even you go to like local supermarket, you expect things to be the way they are.
Yeah.
But you go to certain stores that claim to be like more health minded, and you kind of let down your guard and you start saying, okay, well, these crackers with seeds. They look pretty good and healthy-ish.
Yes,
it'll be a fine snack. I forget what they were called, but so I bought these crackers and I was eating them for like weeks and weeks and we were really liking them. And then I'm like, let me check the ingredient list.
Uh-oh.
A bunch of vegetable oils and all this kind of stuff in there. I'm like, why would you put vegetable oil in this little tiny cracker? Like, what's?
Yeah, no kidding.
So it was very sad for me, like once I get addicted to something delicious, for me to let it go, it's very hard.
Yeah.
Now I am like so cautious about anything I buy anywhere.
Yes.
More than once. So yeah. It's unfortunate that we have to live like that. Like we buy stuff for our kids, kind of trusting the powers that be that they're not going to be poisoning us. But it took them 50 years to remove red number 3 out of the red dye out of our food supply that we've been feeding our children for all this time.
Yeah.
50 years? Seriously? That's unbelievable.
Hey, this is Dr. D. I just wanted to remind you that you can get started on your true wellness journey. Go ahead and check the show notes and grab a link to the True Wellness Checklist. Now, let's get back to the episode. So it's really important for us to be advocates for our own health, to be looking, learning, exploring. I always tell our clients, like, okay, so the truth is, right, you've got to give ourselves some grace, right? There is this like spectrum where things could be way worse and way better. And, we're somewhere along that spectrum in all the different areas of our life. Just figure out where you are and then just keep moving in the in the right direction, because you didn't know there was vegetable oils in those crackers.
I'll tell you something else, Dr. D. I don't think the average person is capable of doing that. I'll tell you why.
Okay.
If we were living in the regular world where, we live in a farm and we grow our own apples, yes, and we have our own chickens and we pick our own eggs.
Yes.
We kind of know the environment and we wouldn't consciously try to poison any of that and right, undermine it. Unfortunately, we live in an environment that you have to be a rocket scientist or you have to be Dr. Daniel Zanzarov to be able to figure out how to navigate all of this nonsense with a PhD.
True.
So what I think people have to do is they have to develop a lifelong relationship with their practitioner.
Yes.
You have to get rid of all the bureaucracy so it's very accessible and affordable. And just like you pay for health insurance, you have a monthly membership with your practitioner. That's health assurance. You assure your health and well-being because on a regular basis, first of all, you're working with somebody who knows you like nobody else. Yeah. They know your genetics. They know your blood. They know your digestive function. They know your proficiency for destructive things. So you check in with them, once a quarter, just to make sure that they're optimized. Their vitamin D is high. Their heavy metal load is low. All the bugs that encourage longevity and digestion are
nice and happy microbiome.
happy, abundant.
Yep.
And so you don't have to wait for a brick to hit you in the head, but you can optimize your body in such a way that you become virtually impervious to a lot of these chronic conditions. I mean, we saw this was a stress test, this COVID thing. Mm-hmm. We saw how weak we are.
Right.
When you're hit with something like COVID,
yes,
people just folded because they already have like 2 or 3 or 4 comorbidities. They're on already 7 medications. So this stress test hitting their immune system, that was a knockout blow for a lot of people.
Yeah. It was, in some respects, though, Alex, it was a blessing because I think a lot of people began to realize, like, oh my gosh, nobody's coming to save me. Like, I need to start getting into the driver's seat of my health.
I agree. I think talking to people now is very different than talking to them in 2019.
Right. Yeah, absolutely.
So our eyes were open, wide open. Of course, some people are funny, no matter how much evidence is presented, no matter how much evil is in front of them.
It's hard to see.
Once they bought it, they won't let it go.
Yeah.
They'll fight for it. They'll call you all kinds of, they'll insult you. Well, why? Listen, it's funny. When I go to a supermarket, right? Mm-hmm. It's like 50,000 products. And if I don't like a particular product, I don't start attacking the clerk or the shelf.
Right.
That's called insanity.
Yes.
I just walk by it.
Yes.
But a lot of people, they make it a point to share their unsolicited opinion about what they think of what you're doing, what you're trying to do, who you are, what your motivations are. It's unbelievable.
Right. Yeah. I mean, I think too, I'll say as an unconventional practitioner, as a holistic practitioner, right, you get all sorts of like, oh, that's woo woo, or that's strange, or that's, just go to your doc. I've had clients who tell me their family members, like, just go to your doctor. And they realize, like, oh my gosh, but my doctor, first of all, the doctors aren't trained. Traditional training doesn't even touch on the surface of nutrition, which is the foundation of what it is that we are surviving on, our body is built on. And so there's all of these fundamentals that are missing. So we've got to, I always say, for me personally, I like to look at things from all different angles. I ask a lot of questions. I know sometimes I can annoy people with a number of questions that I ask, but I really like to understand as many different perspectives of something as I possibly can. Because when you can see something from 360 degrees, then you can make a more educated choice or decision. You can move forward in a more educated way versus being like, no, I don't want to look in that way. I don't want to look at that way. Like, just look. You don't know what you're going to uncover or not uncover. A lot of times there's things that, if I wave my hand behind my head and my fingers are moving, I can't see it. I don't know that my fingers are moving. If it wasn't my fingers, right? But it's not until you actually bring it to the front where you're like, oh, look at that. That's happening behind me. I didn't even know what was going on. Yeah. And so I think that's where a lot of us have gotten stuck. It's like we've gotten stuck like the little fleas in the jar in the paradigm. And it's like, we've got to be willing to take that risk, step out of that paradigm, start to look at things differently, to really be like, oh, okay, there is a whole other world out there. And maybe I'm stuck with this psoriasis or this chronic health issue or whatever, because I haven't seen the other way. I know, Alex, in your book, you have one of the best quotes, and I want you to talk about that quote with our listeners, because you say, if a cure exists, you'll find it. What do you mean by that?
Well, kind of taking this journey myself, I saw things that I believe to be true. And that is the fact that if you're in a particular system, like let's say a medical doctor, for example, they're much less open to seeing things from different angles as you would, or maybe I would.
Right.
So these are trusted professionals, empty after the name, but a lot of them for many years dismissed this idea that vitamin D is an important aspect of your health and well-being.
Sure. Mm-hmm.
And vitamin D can solve a lot of, vitamin D can be a simple solution to a lot of complicated problems. Yeah.
Yeah.
So if you're stuck in a particular ecosystem, and every doctor you go to has been trained by the same pharmaceutical industry,
yes,
and and they went to the same college and have the same professors and have the same business model, then you're going to keep getting the same answer to your problem, and you're not going to find a solution there.
Right.
And a lot of people, after going to 1, 2, 5, 10, 20 of these doctors, they say, okay, there is no cure. I have to keep taking this medication for the rest of my life. I need this particular surgery. I'm going to die in 4 months, whatever it is. But if you open up your mind a little bit and you start searching, there's a lot of really amazingly brilliant people out there.
Yes, there are.
Who are really committed. Like, they risk their life. You saw a lot of these doctors during the whole COVID nonsense who went out there. They risked their license. They risked their freedom. They risked their sanity. They risked their life. They risked it all because they're truly committed to the health and well-being of their clients.
Right.
And nothing could pry them away from that. So if you kind of open up your scope a little bit and start searching in different areas and try different people, like Dr. D, for example, you may just stumble up on a miracle. But if if you keep doing the same thing over and over again, as our great Albert Einstein once said, you're going to keep getting the same stupid results.
Yes.
I'm paraphrasing a little bit, but the point is that, but a lot of people are afraid. The doctors are afraid to try something different. Their patients are afraid to leave their doctor.
Yes.
They're afraid to pay any money out of pocket. That's like a big fear for a lot of people.
Yeah, absolutely.
Because they've been sold the idea that healthcare should be free and you should be working for free.
Yeah.
But you and I are against that slavery concept. We feel that, we got the the knowledge, the education, the resources, the effort, the time we put into it.
Yes.
We to be able to pay our rent and feed our children. I think that's fair.
That's totally fair. But you're so right. It's like we have been conditioned in this way, and it takes some courage for people, I think, to actually step outside of that conditioning, to be like, oh my gosh, what if I've been doing the wrong thing? And there's even some cognitive dissonance there, right? There's even some cognitive dissonance. And, maybe what we need to do is embrace a little more cognitive dissonance sometimes, just to explore that. When I was younger, I got to a point in my life, well, I was younger, but it was still a point in my life at that, at my young 20-year-old self, where I was like, I've got to like break free of everything that I know. And I went and I lived in Japan, and I couldn't read and I couldn't speak and I couldn't read labels at the grocery store. I couldn't do anything. Right. And it was like, but I wanted to be in that experience because I wanted to learn from the ground up, like what it was like to actually truly live versus kind of the same old thing that I had been stuck in, doing the same old things over and over. And it's a different experience. So imagine if we just kind of looked at our health like as if we had just come out, we knew nothing about health at all, and we just engaged with that curiosity. If you didn't think, oh, headache, aspirin, right? If we got rid of those automatic responses, Nutella, excellent breakfast, like if we just got rid of some of those natural responses and started to look with fresh new eyes, things would change.
Yeah, it's not an easy journey. That's why a lot of people have to develop a really awful chronic condition and then bang their head against the wall as they walk around with their insurance card like a lost puppy. Can you help me? Can you help me? I'm sorry. Can you help me?
Yeah.
When they become frustrated enough, I think they'll start seeing. But that's the problem. By the time they get smart enough and they're frustrated enough, their condition usually becomes so advanced that a lot of times it becomes very, very difficult, even for geniuses like Dr. Danielle Zanzaro, to solve the problem. That's not fair. Why you got to show up with this? If you were here, a year ago, I would have fixed it with, vitamin D and some apple juice or something. Much easier.
It's so true. But the word that comes to mind is courage, is bravery. It is like being willing to do something different and step outside. I know I've said that, but it really is, we've got to start looking at things differently. Because if we're not, then it's like the doctor that came to you who's like, oh, look, there's psoriasis. Let me just give you that thing. And then here you are, and your body's screaming. And now you've got the arthritis and you can't move, and you're in your 30s. And what does the future of your life look like?
Yep. Bad.
Yeah. And this is where we get stuck. And the thing is, the thing about our health insurance, Alex, that I think people, part of that kind of being stuck in that paradigm is they don't realize. Medicare informs a lot of the insurance companies, and they say specifically care that seeks to, promote health, prevent disease, and enhance and prolong the quality of life.
Medically necessary. Yeah.
Not considered medically necessary. That's the quote. Right. And so here we are thinking like you're walking into your doctor and you're going to get, great care. But like the care that we provide in our practice, for example, it's not covered because it does those things. So we're walking around thinking that this magical card is going to help us. And, I always tell people like your health insurance card, it's like your homeowner's insurance. It's like your car insurance. It's there for the crash. Right? It's not there to change your tires or change your oil or maintain your engine. It's there for the crash. It's there for the emergency, right? But we don't think about it that way because we don't realize that's what's happening. Even, women come and they're like, I've had some people say to me, they're like, well, but take the mammogram, for example. I go to my mammogram, it's preventative. And so I always ask people, is that mammogram really preventative?
Yeah.
It's only there to detect disease, not to actually prevent disease. We can make an argument about radiation actually causing disease as well,
Yes,
but it's
okay.
not there to prevent disease. And there was a study that came out, I guess it was a year and a half ago, that even showed that so many women were having procedures done because they were falsely, diagnosed with breast cancer from the mammogram.
Yeah.
And so you start to shake your head and you're like, oh my gosh, like, wow. I thought this was going to save me. It's not saving me. And I think it's
Well,
when people realize that they,
that's if you're generous and you give people benefit of the doubt that their intentions are good.
yeah,
There's also a lot of shysters out there,
that's true.
and I've read a bunch of them. I don't know if you read about Dr. Death, for example. He was a surgeon that on purpose did a lot of really horrible things.
Oh, yes.
Yeah.
Yeah.
So that was a travesty. And then there's this whole scam that they did in California where they would do surgeries for like $500,000 a pop, using cheap materials. Like they wanted to save money on the screws even. They did it. They had a whole kickback thing where they would send people who didn't really need surgery and they would do surgery, then bill their insurance for $500,000 and then install cheap screws. I'm like, how much are screws? Like, how much are the good screws?
Yeah. Here's the thing. I mean, even we can debate like what the shysters are and stuff, but think about this, right? You've got big pharma, you've got big food, you've got these really big companies, and it is their fiduciary responsibility to make money.
Fiduciary, yeah.
It's totally competing odds. I don't know if you've I'm not sure if I have the order correct, but it's sugar, salt, fat, or fat, sugar, salt, whatever the arrangement of those three words is, by Michael Moss. And when you start to read that book and you realize the amount of money, for example, that goes into the food industry to just have you come back for more. And what do you say? I mean, people's 401ks are in there. Their money's in the stock market. Their money's in these companies. And so it's completely a conflict of interest. How can they be working for the best of your health, but they've got to give you that perfect amount of sugar, fat, and salt to keep you coming back for more sugar, fat, and salt that's designed to make you sick? And so people have to be willing to step out of it, right? Entirely.
Yeah, and it's hard. They addict you.
Yeah.
It took the tobacco industry like 5 decades before they admitted to the fact that smoking actually causes lung cancer.
Yes.
So did they just fold up their tents and go home to their mansions? No, they bought all the food companies.
Yeah.
And now they figured out how to addict you with that, how to make the most amount of money possible.
Yeah.
At the cost of your health, your children's health, and our national health and well-being. So
yeah,
my hope is that RFK gets confirmed.
Yes.
And he begins a movement of cleaning up the health, the food supply, like he did with the Hudson River.
Yes.
And I believe he has his heart in the right place.
Yes.
There's a lot of people are attacking him. But when you yourself are trying to do something from the bottom of your heart for the benefit of your family, your friends, your community,
yes,
then when you meet somebody else who's also trying to do that from a different angle, their energy resonates.
Yeah, of course.
I've come across a few shysters in my world where I misread the energy, but for the most part, our people are very easy to recognize.
Yeah, I hear you. I know, Alex. So I know we can't fix everything, but you did write a book on longevity. So what are some of your key secrets or things that you've learned in your longevity research?
Well, I'll tell you the most important thing. Like we can talk about akkermansia, the bug that tends to be inside the digestive tract of some of the people who live to be over 100.
Yes.
We can talk about the importance of high vitamin D level. I like mine extra high.
Yes.
We can talk about removing heavy metals. We can talk about knowing your genetics and making sure, like if you have the MTHFR gene, that you supplement with a particular type of glutathione, well, yeah, whatever, all that stuff.
Yeah.
But I think what's most important is that you create the right context for your human optimization and longevity.
Yes.
And for that to happen, you have to have a relationship with a practitioner who you work with on a regular basis. You don't go to them just when you develop a chronic illness and after you went to all of your allopathic doctors who try to put you on all kinds of different medications.
Yes.
You want to work with this person on a regular basis, like you are a Ferrari, and you bring it in for maintenance every so often. And you spend the money to change the oil. You spend the money to get new windshield wipers. You spend the money to put quality gasoline in there. You spend the money to make sure your tires aren't, they're not bald and you're not going to get into it. So if you optimize your Ferrari like that on a regular basis, you can have a classic that still runs like new when it's really, really old.
Yes, exactly. Yeah.
So theoretically, at least, that's what I think.
Yeah, we gotta look at ourselves like that Ferrari. We've got to bring back that self-love, that self-compassion, that we've got to bring some more focus to our health, be willing to invest our time, our effort, our energy, our finances to actually make that happen. The truth is, when it comes to finances, you're either going to pay one way or the other, unfortunately, right? If you look at what is happening with people's health, and I think the statistic is the last 10 years of our lives as Americans are spent with having to have somebody else take care of us.
Yeah.
That's just mind-boggling. The average American over the age of 65 is on 14 different medications. Like, whoa.
That's the worst statistic in the world. We're the worst like that.
Yeah.
12.5 years of the crowning decade, as I call it. We spend on medication and pain, suffering, brain fog, oblivious, dependent.
Yeah.
Who the heck wants to be 100 like that? I don't.
No, I always say I want to be like the great-great-grandma, at my great-great-grandchild's wedding, like doing the boogie woogie on the dance floor and going viral on social media because they're like, oh, look at that really old lady. How does she do that? Like that's what I want.
Well, you have to enjoy every chapter, every phase of your life.
Yes.
And us being in our, whatever, from 60 to 100 or above, can be a very beautiful part of our life. But if you got to 50 without doing anything, that's a blessing. You thank your Lord and express your gratitude. But from 50 to 100, it's not going to work that way.
Yeah.
If you're depleted in vitamin D for an extended period of time, if it's under 20 nanograms per milliliter and you don't know that, you have a 75% chance of developing colon cancer. Once you develop colon cancer and you go to a hospital with your health insurance card, they are not going to put you on vitamin D. They're going to do surgery because surgery is $150,000 they can bill from your insurance company. They're going to torture you. They're going to go medieval on you for $150,000. But if you optimize yourself with vitamin D, you can't prevent everything. You can't avoid everything. Life is unfair sometimes.
Yes.
But you wouldn't talk like that about our house or our car or our clothes or anything else. Like, we understand maintenance is important if we want to keep it longer, if we like it. And I like it.
Me too. I like the roller coaster ride. Yeah. And we're fortunate. And, I'm grateful to have you here sharing this too with our listeners, because sometimes we don't stop and look at things this way. We just keep on going. We get distracted by life, or we're busy, or we're just doing what everybody else is doing, going along like everybody else. But we're gonna change things. I don't even know, Alex. Most people don't. At least the people who come to see me are not getting to 50 with nothing going on. We've got a lot of perimenopausal and menopausal women. They're having the worst perimenopausal or menopausal symptoms, and it's just because the body's out of balance, right? And so,
well, women, I think are the worst like that, because they are naturally giving, caring,
Yes.
They put themselves last. They take care of their children, their husbands, their business, their work, their employees, their everybody.
Yes.
And then they run themselves ragged. And when they hit their 50s, I met a lot of brilliant, remarkable women who have the potential to still contribute. And they become disabled, except Nancy Pelosi. I don't know how that woman.
Yeah, I hear you. Yeah, and so it's a wake up call. But we're at least fortunate enough to be here to talk about the need for that wake up call and for people to listen and be like, hey, let's start to peel back the curtain. Let's start to look at what we need to do. How are we going to optimize ourselves as human beings? How are we going to move to that place of longevity? So I thank you so much for being here with us to discuss that. And I always ask everybody, Alex, I want our listeners to know from you, from your perspective, what are the just 3 things that they could action things that they can be able to take on right now to optimize their health, the longevity, their future, their life.
I'll give you one very important thing.
Okay.
Ask Dr. D if she has a membership model. Pay her once a month for the rest of your life.
Yeah.
And let her become your partner in the optimization and circumvention of all these chronic conditions that we're told are inevitable and incurable.
Yeah.
And you will be an inspiration for everyone in your life because you will live longer, you will live better, and you will save yourself a lot of really unnecessary drama that most of your friends will be unfortunately contending with. So
yeah,
I think that's the most important thing.
Well, thank you for that shout out. All right, Alex, thank you so much for being here. And Alex Lubarsky's information is in the show notes, so be sure to check them, grab a copy of his books, and take a step forward to your own human optimization. This is Dr. D reminding you to tune into your body, connect with what matters, and embrace the journey to true wellness. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who's ready to redefine their health. Be sure to grab a copy of the True Wellness Checklist right in the show notes. Let's keep redefining wellness and empowering change together. See you for the next episode.